When Cecilia Perez was diagnosed with the very rare condition aplastic anemia, she was scared and didn't know where to go to get treatment. She soon realized that state-of-the-art comprehensive cancer care at the Community Cancer Institute was right in her backyard.
Hi, Cecilia. How are you doing today?
When Cecilia first met Dr. Haifa Abdelhak, she was very sick. The 27-year-old says she had never had health issues before, but one day in April of 2020, she went to the hospital with a high fever and body aches.
I was actually in liver failure, and so I was admitted. They started trying to treat the liver, trying to figure out what's going on, what's causing it. Then I went into heart failure.
She was transported to a hospital in San Francisco and diagnosed with aplastic anemia.
I was like, well, who do I see? And the doctor there said, hey, we have a very good oncologist in Fresno, well, Clovis, and she specializes in this.
Dr. Abdelhak, who is a hematologist at the Community Cancer Institute, explains.
Aplastic anemia is a bone marrow failure. It results from an immune injury to the stem cells in the bone marrow, low white cell count, red cell count, and platelets.
She goes in depth into how Cecilia may have gotten the aplastic anemia.
It can be either inherited or acquired. And the inherited aplastic anemia could be through certain genetic alterations. It can also happen in the setting of viral infections, and many viruses can do that. We think that it is a viral exposure that caused this because all the workup did not show evidence of autoimmune disease. However, I am now in the process of doing some genetic evaluation to see if we have any genetic predisposition.
Cecilia needed her blood counts to recover. Dr. Abdelhak says a bone marrow transplant is often recommended for patients with aplastic anemia, but when there is no immediate availability for a donor, she advises patients undergo triple immunotherapy.
Triple immune therapy is basically a combination of 3 medications. So the combination of these 3 medications is quite effective. The response rate to this combination is more than 90%. It does, however, require some time, so we have to be patient, and that's what we did with Cecilia's case.
There has already been improvement in Cecilia's blood count since her treatment. Cecilia says receiving care locally at Community Cancer Institute has provided her and her family relief through this difficult diagnosis.
It's been great. I don't have to go up north or anything. I don't have to make that long commute. Don't have to spend too much money on it.
The incidence of aplastic anemia is not more than 10 in a million. It is quite a rare disease, and we don't see a lot of these patients with this condition. It is more common in pediatrics than in adults. And when it happens, patients should be really treated in experienced centers because patients do require a lot of supportive care until the treatments kick in and their counts improve and their immune system is stronger.
Dr. Abdelhak says Cecilia's prognosis is positive, and with the triple immunotherapy, she suspects the chances of relapse to be very low.